Hello friends, welcome to Mock Test channel. Today we will be going to go through most commonly asked questions in the Medicare exit exam. Friends, before you proceed any further, please make sure that you press on that thumbs up button so that YouTube algorithm understands that this content is very useful for seafarers to pass their Medicare exit exam. Which of the following sign may go away as the hypothermia worsens? A. Slurred speech. B. Confusion. C. Shivering. D. Unconsciousness. Correct answer is C. Shivering. If you are stranded in extreme cold weather, where should you stay? A. In an ice shelter. B. In the car. C. Outside by a fire. Correct answer is C. In the car. Signs observed in hypothermia: A. Slowing of pace. B. Stumbling. C. Thinness of speech. D. Drowsiness. Correct answer is C. Thinness of speech. Radiation means: A. Indirect transfer of heat to environment. B. Direct transfer of heat to environment. C. Direct observation from the environment. D. Direct passage of heat to the environment. Correct answer is B. Direct transfer of heat to the environment. At what stage of immersion does the falling body temperature becomes a primary hazard? A. Initial immersion. B. Short-term immersion. C. Long-term immersion. D. Post-immersion. Correct answer is C. Long-term immersion. BLS is: A. Basic life science. B. Basic lean and support. C. Basic life support. D. Basic living support. Correct answer is C. Basic life support. In order to initiate CPR on drowning victim, A. Start chest compressions before the victim is removed from the water. B. Drain water from lungs before ventilating. C. Begin mouth-to-mouth ventilation. D. Do not tilt head back since it may cause vomiting. Correct answer is begin mouth-to-mouth ventilation. When applying chest compression on an adult victim CPR, the sternum should be depressed about: A. Half inch or less. B. Half or 1 inch. C. 1 to 1.5 inch. D. 1.5 to 2 inch. Correct answer is D. 1.5 to 2 inch. Medicare service is: A. Simple transportation system. B. A first aid system. C. A system in which the Medicare is given along with transportation. D. A system where doctors and nurses are actively involved. Correct answer is C. A system in which Medicare is given along with transportation. Atmospheric air contains: A. 16% oxygen. B. 18%. C. 21%. D. 26%. Correct answer is C. 21% of oxygen. How many compressions should be given per minute? A. 80 to 100. B. 80 to 90. C. 70 to 100. D. 70 to 90. Correct answer is A. 80 to 100. The accepted treatment for femur or thigh fracture is: A. Place short padded splint on each side of the leg. B. This type of fracture is best handled by a splint applied by those with specialized training. C. Move the victims properly, applying the leg splint. D. Bind both legs with two long splints using two cravats, or one above and one below the break. Correct answer is B. This type of fracture is best handled by a splint applied by those with special training. What is the difference between HIV and AIDS? A. HIV is a virus and AIDS is a bacterial disease. B. There is no difference between HIV and AIDS. C. HIV is the virus that causes AIDS. Correct answer is C. HIV is the virus that causes AIDS. Window period or zero negative period can last for: A. 3 months. B. 4 months. C. 5 months. And D. 6 months. Correct answer is D. 6 months. At the beginning of a therapy, the first combination of drugs is called: A. Frontline therapy. B. Third line therapy. C. First line therapy. Correct answer is C. First line therapy. Which type of treatment can recover the damage that HIV might have caused already? A. Antiretroviral drug treatment. B. Vaccine therapy. C. Radiotherapy. Correct answer is A. Antiretroviral drug treatments. The escape of HIV from immune response can be caused by A. Immune escape. B. Isotope variation. C. Epitope variation. D. Immune variation. Correct answer is C. Epitope variation. HIV virus can replicate itself inside A. Human cell. B. Mosquito cell. C. Monkey cell. D. Pig cell. Correct answer is A. Human cells. Which country has the highest number of people living with HIV? A. South Africa. B. Nigeria. C. India. D. Pakistan. Correct answer is A. South Africa. HIV prevention can be made difficult by all except A. Physician's ambiguity. B. Social ambiguity. C. Language barriers. D. Failure to convince patient. Correct answer is D. Failure to convince patients. What color will appear if patient serum is positive for HIV antibody in ELISA? A. Yellow. B. White. C. Purple. D. Green. Correct answer is D. Green. Approximately how many people are living with HIV worldwide? A. 33 million. B. 23 million. C. 13 million. Correct answer is A. 33 million. In animals, research lessons to which part of the brain have been shown to cause appetite loss resulting in self-starvation syndrome? A. Lateral hypothalamus. B. Cerebellum. C. Amygdala. D. Basal ganglia. Correct answer is lateral hypothalamus. Cancer of the cervix in women can be detected by regular pap smears. A. VAT test. B. ELISA test. C. Pap smears. Correct answer is C. Pap smears. Pick one of the following familiar factors that plays a role in development of eating disorder. A. Parental attitudes to sex. B. Parental obesity. C. Parental attitudes to the media. D. Parental attitudes to education. Correct answer is B. Parental obesity. One of the most common treatments for eating disorder is A. Electroconvulsive therapy. B. Medication. C. Family therapy. D. Aversion therapy. Correct answer is C. Family therapy. Norovirus is a type of virus which affects A. Central nervous system. B. Gastrointestinal system. C. Cardiovascular system. D. Skin disease. Correct answer is B. Gastrointestinal system. Too much alcohol can damage the dash and can contribute to some cancers such as throat or liver cancer. A. Kidney. B. Liver. C. Brain. Correct answer is B. Liver. Thanks for watching, friends. I wish you all the best for your exam.